start the recording. And we go back to the slide we've just discussed. So, which is about the amount of children that visit doctors. Can you see the slide?
Yes.
Yeah.
How many pictures are there in the slide?
3.
Okay, great. Yes. And these pictures actually they illustrate the different ideas. The ideas like taking care of children, the development of technology, medical technology, and taking care of elderly people. So this which is called geriatrics. So, and the question here, which areas do you think should have priority in any modern health spending? For example, child health, geriatrics, technology, or any other. And here we speak about health spendings because these are this is the money that the government just spend on this kind of spendings. Yes, like the government provide money for the development of some healthcare system for children, for elderly people, or to the development of medical technology. So, and which of these spheres should have priority? Who would like to speak about this?
Can I, Doctor?
Your name?
Tala.
Tala, please.
I think the modern health spending, it will be about technology, because I think it will be technology, they help so much, and it's will one of the most important things. It will be because it help greatly in development in treatment.
Yes, because everything depends on the development of technology. I see. Okay.
Yes,
so yes, your name?
Mohammed Nabil.
Okay, Mohammed Nabil, please.
Yeah, I would say that every one of them is completing each other, and all of them is important. But if I would choose, I would choose technology because it will be really have a lot of benefits in all the area about the child health and geriatrics and any area. So I think technology is modern health spending more.
I see. Does everyone agree with this expert opinion, or does anyone have a different opinion, different point of view? Okay. Yes. Yes, I agree that all these things are important. All these spendings are very important because we should take care of children because they are at the beginning of their lives, and they should be healthy because it means that they are the future citizens of the country who will just work for the country, just take care of everything, who will be the leaders of the country in future. And of course, we shouldn't forget about elderly people because they just devoted their lives to the development of the country. And technology, yes, everything depends on technology. And so I would like you to focus on the following on this slide. So here you can see the table, and there are several positive and negative adjectives here. They describe the qualities of a good pediatrician. Pediatrician is a person who treats children. And so you can see positive adjective like patient, efficient, reliable, sensitive, honest. And we should write the corresponding negative adjective. And I would like you to use the negative prefix. Most of them can be just we can make the negative form with the help of the prefix, negative prefix. Like in the first line, patient. And what is the negative? The opposite of patient. Which?
It will be he has no flexibility in dealing.
No, I mean which prefix should we use in make up the opposite form of patient?
Non-patient.
Impatient, yes, impatient. I am impatient. So please write the adjectives in pairs, positive plus negative form. There should be 7 pairs there. So like 2 minutes for you to write them. And for diffident, you should write the positive form, and for disrespectful, try to use prepositions, prefixes.
Write it now, Doctor.
Yes, yes, write it now, and 2 minutes. Well, so we've just decided that patient, the negative form is impatient. Dilara, what about the second line? What did you write?
Second, I think confident.
Confident, diffident. Okay, so Bere, the next number 3. Bere, are you here? No. Esginur?
Yes, doctor.
Yes,
I'm here.
doctor.
Bere?
Yes, I am here.
Okay, Bere, please read line number 3.
3. Invented.
So efficient, which is positive, and inefficient. Yes. Mhm.
Efficient.
Okay.
Yes.
Inefficient. Okay, Esginur, please. The next number 4.
Unreliable.
Reliable, unreliable, right? And so the Jeren, please. 5.
Insensitive.
Sensitive, insensitive, right? And Yahya?
Honest, lying.
If we make the negative form with the help of the prefix, which prefix should we use here?
Non-honest.
I think it's the same as in number 7. Dishonest. Yes?
Dishonest.
Dishonest, yeah. Okay, and so Mustafa, Sabir,
Yes, respectful.
respectful, disrespectful. So we've written these words, and you can see that different prefixes can be used to make the negative form of adjectives. So it's like better to remember them. There are some rules, but it's easier to remember the forms than the rules here. Okay, and here are the sentences that we need to use these adjectives both in negative and in positive forms. So we should analyze the situation, and we should understand which adjective suits each gap, each just description, each story. So for example, the first one, Dr. Manson is very, in everything she does, she prepares for ward rounds methodically, and everything is where it should be and in order. So if everything is in order, how can we describe her behavior? So using the adjectives from the table that we have just completed. So what is the best word here?
Efficient.
Efficient, right. Dr. Menser is very efficient, yes. So please look at the other words, the other sentences, other situations and descriptions, and just write which word is missing. So the word from the table that we have just done. So 2 minutes for you to do this now. So have you done? Okay, let us check. Yes, Tala, please. Number 2.
I think about Statement number 2, Dr. Mubarak is very incompetent sort of person, so he does think quickly and often makes the parents and children nervous by showing he is want solution to end.
Competent,
Incompetent.
confident,
No, incompetent.
unconfident,
I think it is non-patient.
impatient.
Hmm.
Yes, because yes, it's better to use impatient because so he behaves like moves very quickly and
Incompetence, yes.
yes, impatient just makes people nervous. Mhm. Okay, well, Yosif, what do you think of number 3?
Dr. Andrews is very to all patients, respectful.
Mhm. Mhm.
He greets them probably and takes their.
Yes, takes their
I
wishes
think
into
it's
account.
respectful.
Respectful, yes, respectful, good. Well, the next is for Shema, please. Shema, hello.
Yes,
You here? Mhm.
Dr. Chandos is not very honest with himself.
Uh-huh.
He finds it difficult to admit his weaknesses while showing off his strengths.
And being
Being
realistic. Yes.
about weaknesses helps us to learn and develop our skills.
Mhm. Okay, so honesty is the best choice here. And do you agree with this, that this statement that being realistic about weaknesses can help us to learn and can develop our skills? Do you agree with this?
Yes.
Mhm. Mhm. So, okay. And the next number 5, let us listen to Dilara, please.
My college can be very, she annoyed the patients when she referred to her husband and she wasn't married. The patients was quite upset. I think insensitive.
Insensitive, yes, because he doesn't want to understand the feelings and conditions of maybe, yes, of her patients. He doesn't know whether about the marital status of her patient. So that is why it's very important to, like, to ask questions for the doctor, yeah? Important for the doctor to ask questions. Okay, the next is for Bere. Mohamed Nabil, please.
Yes, Barry, I am here.
You are here, Bere. So, okay. Yes, Bere.
5.
No. 6.
6, sorry. It is not easy to feel confident. I think confident the first time you do something new, but with practice, you begin to feel very good about it.
Okay, yes. So the more you do something, the more confident you become. And so, Mohamed Nabil, please, number 7.
Yes, Dr. Kamara, since the team thought she was, because she let them down, she made mistakes in the unreliable. She was unreliable.
Because she let them down, she made mistakes on the word and was late on several occasions. Okay, so and these are the just the characteristics of several doctors. And if we have a look at the next slide, so the task here is to make a list of other qualities you think a good doctor needs to have? What can we add to this list, which was like in the table? Of course, we should look at the first, the left-hand column, like patient, confident, efficient, reliable, sensitive, honest, respectful. What can we add to this list? What other qualities should a good doctor possess? Ezginur, what do you think? Plus to the qualities that we have written in the table.
I don't know.
Okay, so Tala,
I think we should add flexibility and ability to handline with patients.
flexibility, you say?
Yes.
Okay, okay, right. And so Mohammed Nabil, what do you suggest?
Tactful. I think it's need to be the way that he talk and the way that he deal with the must be more tactful.
Exactly. So this is just about communication skills, yes? Okay, and so are there any qualities that a
Can
pediatrician?
I?
Yes, your name?
Yusuf.
Yusuf, please.
Okay. The doctor should be to be with and how to do the right thing in many situations.
Okay, you are you speaking about being professional?
Yes.
Okay, yes.
Doctor,
And experienced. Yes. Who else?
I think the doctor must be social.
Social. Socialize, yes. Why? Is it about having communication skills?
Because it make speaking with the life with a patient very easy.
Yes, right. Okay, good. Thank you. And the question, are there any qualities that a pediatrician needs to have more of than other doctors? So that are very essential for pediatricians. What are the qualities that a good pediatrician should have? Pediatrician, yes, please.
They should all be helpful and patient, but I think pediatrists should be more patient.
More patient.
Yes.
Yes, more patient.
Also,
Okay, yes.
he must
Can I?
be smiling, for example.
Yes, just to help to comfort a child. Okay. Yosif. And
Yes, doctor. It's so important to have a lot of patience and runs for the screaming and sharp crying of children, and to be receptive to the inconvenience.
to be receptive.
Yes.
I see. Okay. Okay, I mean that so the being pediatrician requires some specific just qualities from the doctor because they work with children and So they should be very careful about this. Mhm. It's more difficult, I guess, to work with children than with adults in some cases. And now we are going to read about Dr. Nasreen Ahmed. And so actually she is a pediatrician. And let us just read and understand so about how she works and what's important in her job. Well, now let us listen to Jeren. Start reading, please.
My name is Dr. Nasrin Ahmed and I work as a pediatrician in a Central Auckland, New Zealand hospital. I have always enjoyed working with young children and their parents. One of the main factors that led me to consider specializing in the field was my own experience of bringing up my two young children. The understanding this has given me has helped me to empathize more with parents when they become very anxious.
So this is the information, some personal information about Dr. Nasreen Ahmed. So where she works and her family members. Okay, and the second part of the text. Yahya, will you read it, please? Yahya, hello?
Yes.
Are you here?
Okay. Bringing up my own children has made me actually aware of the parent of the
Parental
fear
fear.
of potential threats throughout childhood from infant disease illnesses like infectious parotitis,
Parotitis.
varicella, morbilli, rubella, pertussis, acute
It's very difficult to read.
Mindy.
You can divide it into several parts. Yes, this is
laryngotra quiporon sheets.
Laryngotracheobronchitis. Yeah. And then
meaning this
meningitis.
polymyelitis and tetanus, and then there is the parents apprehension associated with vaccinations like MMR. If I weren't a doctor myself, I would probably feel as concerned and fretful about my own children as many of the parents I see who want to discuss combined vaccinations for their children.
Thank you so much, because this part is very hard to read because of the list of the children diseases. And
I actually didn't see anything. I couldn't. My visible isn't clear.
I see. Okay. If we speak about these diseases like infectious parotitis. So infectious parotitis is, does anyone know about this disease? How the person looks and what it means, parotitis? Actually, infectious parotitis is inflammation of parotid glands, just behind the ears, like next to the ears on the, yes, on the neck, yeah. So infectious parotitis. And the next is like varicella, varicella. It's the same as chicken pox. So where we can see just spots on the child's body. Yes, so this is the virus that causes this chicken pox. Then there is morbilli, the same as measles, infectious viral disease. It causes fever and red rash. So then the next is what is rubeola. Rubeola is the same as measles, yeah. Actually, rubeola. Pertussis. Pertussis is also infectious disease, like cough. Children are coughing, and meningitis. Like acute laryngotracheobronchitis is some kind of infection in the larynx, in the lungs. Meningitis, very just serious infection in the brain. Poliomyelitis, so it's associated with increased temperature. So tetanus, like tetanus is, in other words, it's like lockjaw that this disease can be caused by the bacteria from the dirty surfaces that penetrate into the blood. Okay, and yes, if we have a look at the next slide, there are some statements about Dr. Ahmed, and all the statements are false here, and we should change one word from the passage to make them true. We should change something. And let us listen to Mostafa Sabir. The first statement is for you.
Yes, Doctor. Dr. Ahmed has never enjoyed working with young children and their parents.
This sentence is false. So what should we change? Which word should we change to make it true?
Actually, Dr. Ahmed work with children.
And she likes, enjoys. Yes.
Yes.
She enjoys. We can say Dr. Ahmed has always enjoyed working with young children and their parents. Okay. The next statement is for Mohammed Nabil, please. Mohammed Nabil, hello.
Yes. Yes.
Number 2.
Dr. Ahmed has no children. Has no children of her own. It's a wrong sentence, right?
And it's wrong.
So Dr. Ahmed has children of
How
her
many?
own.
How many? Do you remember?
Actually, no.
So
two young children.
Yes. So bring up my 2 young children, she says. Yeah, 2 young children. Okay. Now please, Tala. Sorry. So go back. Okay, Tala.
Okay, doctor. The statement number 3, the experience of raising her own children means that Dr. Ahmed is fairly consistent about the first faced by parents throughout their childhood. It will be wrong because it will be considered specializing, and this feeling was my experience, my own experience. It's bringing up my two young children. It's about specialized in feeling my own experience.
Okay, it's almost correct. So she says, yes, that the experience in bringing up her own children like helps her understand the fears of parents. Okay, good. And now we can just change, instead of fairly, we can change fairly into acutely conscious of the fears faced by the parents. And the next, that was Tala, and the next is for Yosif. Next sentence, please.
Yes, Dr. Ahmed feels that being a doctor possible make her less worried about vaccination for her one children. I think she will interested in them because they have because she have extensive and experience, and she's a doctor.
And so here we can change the word possibly, because she is a doctor and it's not possibly, it's probably, yes, makes her less worried, the fact that she is a doctor. Okay, and the final one is for Shema, please. Shema, hello.
Yes, all of the patients, parents, doctors,